It's Dr. Joel Rosen with a great patient of ours, Sue. And Sue has come by today, and I wanted to just ask her a couple of questions with the positive experiences that she's had in our office and the things that she's done on her own with her thyroid problem. She's given us permission to talk to you today about this. So, Sue, can you tell us how you first heard about our office and what you were dealing with?
Well, it was interesting. I can't totally remember, except that I knew I was doing lots of searches online for alternate methods to deal with the thyroid problem.
Right.
I had hyperthyroid issues.
Right.
And I think that's how your name came up.
Right.
And I saw that you were having a workshop.
Right.
And I was, hold on, let me gather my thoughts here. I was determined to find an alternate method to take care of my problems. And so I went to the
workshop.
To the workshop.
Right. That's
See, my brain's not functioning this morning yet. I went to the workshop, and from that point on, I just decided that was the route to take.
Sure. Okay. Now, but you also mentioned to me that had you listened to the endocrinologist the first time, what would have happened?
Yes. My original endocrinologist had told me the only way to take care of my problem was to ablate my thyroid radioactively.
Right.
And I was not willing to do that because that meant the total destruction of my thyroid, and I would be on medication the rest of my life.
Right. Okay. So then we came to the workshop, and this is a while ago because we haven't worked together.
Yeah, it's been a while.
Right. So now what were some of maybe the concerns or any fears, or what were you really dealing with that made you determined to go and look for alternative health? Like, what was your main problems? What was it?
Well, the things associated with my thyroid issues where I had the foggy head. I had lightheaded issues.
Right.
I would get lightheaded, fatigue, even though it was hyperthyroid.
Right.
I did have the weight loss. So there were just lots of
stuff.
Yeah, lots of health issues.
Okay, and then did you have any fears before you started with us? Any concerns?
No, like everybody, you're looking for something that'll work. So you're a little skeptical. Is this gonna work for me?
Right.
So that would probably be the only thing. I was, like I said, very determined to find something that was going to work for me, so I was willing to try anything to avoid getting my thyroid ablated.
Right, okay, and then having to be on medication for the rest of your life.
Right, especially that.
Right, but you were on medication, though.
They did put me on what they call methimazole, because methimazole is designed to take your thyroid the other way.
Right.
And you end up, at one point, I ended up in a hypo stage.
Right.
Until they could get the medication.
Well, not only hypo, I mean like zero. It was like 0.00.
Well, that was when I was hyper.
Right.
Well, the methimazole takes you up the other way.
Right.
So it's always a balancing act with medication.
Right. Well, no, and also too. So you bring a very interesting point. When we have a primary thyroid problem, and the thyroid's asleep on the job, TSH will go high. So that means that the thyroid's asleep, it's not doing a good job. But if we're taking too much thyroid hormone, and because we have hypothyroid and we're trying to wake it up, then what you see is your thyroid levels go super low, and that would be called a secondary hypothyroidism. And I think we had that for a while in terms of it was super low.
Yeah.
Is that right?
Yeah.
And then you just brought your blood work today, and you're still within the right.
Yep.
Yeah.
I have been in normal ranges for 8 to 9 months now.
Right.
So,
oh, okay, good. And then how does that translate in terms of some of the benefits that you have experienced since going on this route and not getting it ablazed and not being on medication for the rest of your life? Tell us how you're feeling now.
Well, I'm feeling great.
Yeah.
I mean, I have my energies back. I don't have the weight loss issues. Everybody would like that, but
Right,
not good for you. I'm not concerned about the effect on my heart anymore, because that's another thing when you have thyroid issues. I did end up one time with AFib.
Right.
So I don't have to worry about that anymore. Again, everything's returned to normal, and I just keep knocking on wood and following the protocols that I learned with Dr. Rosen
and all the other stuff that you've done as well. And I think that's a big testament to the patient, which you and I talked about, is that no matter how much, as an instructor like you are, you teach your clients how to do things, it has to be them that does the work.
Exactly.
Right.
You can't come in and just think there's a magic bullet.
Correct.
I think I worked here at the clinic for at least a year.
Right.
So it's not an overnight process, but it's consistency that pays off.
Right.
Doing the work.
Right.
Exactly right.
And we haven't seen each other for a couple of years.
Yeah,
maybe,
8 months. Well, no, I think Less than a year, but
It's
probably
okay.
9 months or so.
Oh, it
but
seems so
yeah,
much longer.
I
because I
know.
missed you. So as far as what would you tell patients then that are concerned or fearful? Because of course, a lot with the way healthcare works nowadays is a lot of the quality care or the outside the box care or the non-dogmatic traditional model, it requires things that are going to be an investment, that insurance is not going to cover. So people are going to be fearful.
Well, I don't think you can put a dollar value on your health
Right.
or how you feel.
Right.
How much is it worth to you to be healthy, to
Right.
live a normal life, to
Right.
feel good.
Right.
So for me, it was worth everything, which is not to say that you can't afford to work with a good holistic functional medicine person.
Right.
And this place, your clinic,
Right.
worked with me as well.
Right.
So.
Right. And so now you don't have that fear of heart problems, not having to be on medication any longer, having more energy,
Right.
and just having the quality of life that you can't put a price on.
Right. That's exactly.
Awesome. Well, thank you so much for
You're
doing
so
this. I
welcome.
appreciate that.